Good evening. At this time, we'll begin the Administrative Committee meeting at 6:01 PM. Agenda item number 2.1, Health Insurance Presentation.
So yes, we have a representative from Blue Cross Blue Shield here tonight that will be walking us through a presentation and hitting some highlights with our insurance plan.
Good good evening. My name is Tita Iruegas, and I'm a representative of Blue Cross and Blue Shield of Texas. In conjunction with your agent, Mr. Trevino, I'm here, and you might ask as to why this is the first time that I'm here in front of you, and it's because I was just recently assigned to San Benito CISD. Good evening, Board President, Mr. Moreno, Superintendent, Mrs. Cervellan, members of the board. Today, I am going to present just an overview of how the plan is performing and how it compares to the same period as last year. So you have in front of you the presentation, and the period will be October 2021 through May of 22, which it will be the current, and the previous, it will be October 2020 to May of 2021. I'm just going to give you a highlight. If you need for me to stop at any time or wait until the end for questions, that's what we're here for. The total paid during the current period is $6.9 million versus the prior, it was 5.5. And this one you will see on the bottom, always where it's the small print, is due to currently we have 19 claimants over $50,000. Those 19 claimants had spent 2.6 million of that 6.9, which is about 45.9% of the expenses are for those 19. Previously, we had 10 claimants. They spent 1.8 million, which was about 33% of the total expenses. You will see the average of your employees during that period and the previous period. Currently, 99.7% of the San Benito CISD population that they're covered under Blue Cross and Blue Shield of Texas are seeking treatments from providers that they're in our network. Currently, the savings that you're benefiting, 71.6%, which during the current period is 14.3 million. San Benito CISD, I have, and you will notice that in here I have 11 claimants, and the reason it is 100,000. I couldn't fit the 19. And just to give you an idea as to how much is being spent on those individuals. For the current period, October 1st through May the 22nd, that's 2.1. On the next page, we have your type diagnosis, and those are those high-cost claimants. As you can see, it is neoplasm. For the current symptoms of ill-defined and circulatory, it stayed pretty much the same as the previous period. And your high-cost claimants include the prescription drugs, okay? The top chronic conditions you will see on both periods, it is hypertension. And it's not just San Benito CISD. You know, we have it, I see it, I have most of the school districts here in the valley from Brownsville all the way to Roma. And I see, this is a pattern that I see. So it's not just that you will say, oh, it's just in San Benito. No, it is just our culture, okay? And you can see hypertension during the current period is 2.6 million. The previous one was 760,000.
Why the difference?
Why the difference? Yeah. Remember that we stayed, like my daughter calls it, we stayed because of the COVID, we were home, and we tend to eat a little bit more when we're just there. And we all have experienced a little bit of gain, that weight. It's just a fact. We don't know what to do other than eat. That's all I can say.
Thank you.
I'm sorry for being, but I'm just being honest. And we have to blame it on COVID. We have to, there's no other way. But yeah, you know that the claims that they're incurred, they're not paid, that same month. So we're gonna see that, and that's the reason. On the next one, you have the claims and the enrollments. As you can see, this is another factor that it's everywhere, whether we start with a high number on the beginning of October, the 2021, and as we continue during the month, it goes down from 2,061 employees to 2009 employees. And then in the next one, I'm sorry, it's employees and dependents. And on the next one, we have your subscribers, which is your employees. We started with 1,399, and at the end of May, we had 1,382. Not a big difference. I had given you in there the medical paid claims by month. Just medical was 4.9, and your pharmacy, which is your medications, 1.9. Then we have the ASO adjustments, and that's because you have the individual stop loss coverage, which is insurance to the insurance that you pay, and what we had reimbursed during this period, the San Benito CISD fund. So medical, pharmacy, total paid 6.9, including the adjustments. On the next one, you will see the ER leading diagnosis. I like to show this just so employers can see, what are your employees going to the emergency room for? What are they seeking treatment? What are we paying? And I have in there a column that it says ER potential, not emergency visits. Okay, we can't say for sure that there were something that they could be treated at a night clinic, an urgent care, or taking time off during the day to go and see a doctor or provider instead of running in there. And as you can see, there were about, out of 284 emergency room visit, potentially 59 could have been potentially, not emergency. So the good thing, and if you turn your page, you will see the MD Live. San Benito CISD provides a program that it's MD Live for the employees and covered dependents that they're covered through San Benito CISD. What that is they call, and it's not a local doctor. First of all, they just call the 1-800 number. First of all, they have to register online, and then they can call in and they can get 4 minor medical issues. It's not for everything, and they can even prescribe a medication, and teachers, whomever, they can go get that medication filled. You will see the 237 of 354 that they're registered, 237 of your employees and dependents had seek treatment from providers via virtual visit or via phone. Okay, so it's very good, and hopefully, and we already presented the renewal to Mrs. Cervellon, so we're looking forward to the renewal, and we're gonna start promoting along with the agents and the HR department. We're gonna start promoting more the MD Live, because that's where we're going. That is something that we need to get used to it. On the next page, we have the pharmacy and what was paid, that 1.9 million during this period, and the prior period 1.7. I had given you a breakdown on the generics and the brand name, and as you can see, the brand names, they're more expensive, but we have a high rate of your employees filling prescription, the generic ones. The non-specialty medications, and you will see most of those are for diabetics, which is another condition that it's here in the valley. A specialty drugs medication, and those are for the neoplasms, and as you can see, we do have those neoplasms here in San Benito, and we're incurring those claims. On the next page, I just had provided you just with the names of the medications so you can see your top 3, again, is for your diabetics, which if we look at it is great. You're spending the money on the medication, but at least you know that your employees are taking advantage, that they have your insurance company, your insurance coverage that you provide for your employees, and they're taking care of themselves at the same time. So don't look at it as it's very high expense, so better them take care of it with the medication and not end up at the hospital for that. And on the next one, on the next page, you have that generic, and 77% of the medications are being filled. They're generic, and 23 are the brand names. And again, there's your 197. And I had given you the list of those specialty medications for your information. Any questions?
I do.
Yes.
I'm
Go
sorry.
ahead. Go ahead. You go.
You said, you mentioned that you're going to encourage more virtual visits. However, we don't want to discourage anyone. If they feel that it is an emergency, we do want to encourage to go to the emergency room. We're not pushing away from that, right?
We're not pushing away from that. What we're trying, when we introduce MD Live, it's in there, is to prevent those after hours, holidays, weekends, that the doctors are not in the offices. Your employees will have this option for something like a headache, allergies, high temperature,
So you're referring to very minor things, not,
very minor things. Yes, it's not, and the member, we will have to have like a thermometer, and I think that due to COVID, now everybody owns one, and we feel a little bit warm, and right away, we start checking our temperature and running to go get the COVID testing, which is, it's covered, and it's something that we all need to do. Okay, but no, we're not in any way, and that's why I said emergency room, and then we go into the MD Live, and that is something to promote only and let them know for after working hours, holidays, and weekends. You have that option instead of running to the emergency room.
What kind of visits would the MD Live virtual visits count as? They wouldn't be emergency room visits?
No. This is allergies, this is a
No,
headache.
but what would they be, because when you, what would be your copay for an MD Live visit?
Yes,
There would be a copay.
there's no copay, as I understand, for San Benito CISD.
For-
San Benito ISD takes that copay.
Okay, so if any of our employees or people on their plans would need an MD Live visit, they don't incur a copay?
No, we'll double check for you to
Okay.
confirm.
Ma'am, I have a question for you.
It is
On-
covered by
you
San
did-
Benito CISD.
You did mention diabetic supplies or something
Yes.
like that. Does Blue Cross Blue Shield take care of all that?
Okay, what I mentioned in here was the diabetic medication and diabetic supplies. Yes, sir, they're covered under the medical health. That deductible will apply in the co-insurance, but for those members that reach that 100% during the year, it will be covered at 100%.
Do we have that with somebody else in our district?
We do have a medical supply that provides the diabetic supplies to the members on a quarterly basis. That is my understanding, and the school district gets billed.
Yes, and we were
Dr.
going to look more into that to see how that is working for
Yes.
our employees.
It could probably be cheaper going through Blue Cross Blue Shield than,
Yes, well, we discussed that we were going to look into the intricacies of that. So we don't have all that data yet to make any kind of recommendation,
okay,
but that's
that's fine.
something
I'm
that
just
we're
curious,
looking into.
maybe it helps our employees.
Speaking of,
Thank you, ma'am.
speaking of COVID, do you all do COVID vaccines and COVID shots, or?
Yes, and after that questions page, I included in there the COVID treatment and how much it had cost, 1.4 million. And it gives you in there, the inpatient, how much was outpatient, and the professionals. And on the next page, you will see by year in 2020, 2021, and 2022, it gives you the population, the cases, and how much was it paid. It also includes for the first dosage of that has been submitted of the vaccination. Okay, so you have all that information in front of you, and it gives you the diagnosis, the antibody, all that information is provided.
Thank you, ma'am.
You're welcome.
Are
This
the co-
concludes my presentation. Okay, yes,
Are
ma'am.
the COVID tests free with the insurance?
Yes.
Yes, okay. And one more thing, when it comes to the hospitals and visiting the ER rooms, I recently met with several hospitals, and actually they brought up the conversation about when people go to the emergency room, if it's not an emergency, it does keep other people that are having more extreme situations from being seen, right? So if somebody has a cold and they're being seen at the ER room and somebody else is having a heart attack or a stroke or something, you know, that's keeping those other people from being seen also. So you made a good point that it's important to know what should be taken to the ER and what not, right? And that's why they have the availability to be able to do a session, you know, virtual session, so that way they can identify as well if needed, right? Of course, we're not discouraging anyone from not going to the emergency room if it's necessary, right? But that is a very good point that I did hear from the hospitals recently. Thank you.
Yes. Any other questions? I do want to thank you for the opportunity for Blue Cross and Blue Shield to provide health insurance to your members, to your employees and their covered dependents, and hope, you know, to continue that relationship. And with the assignment of your new agent, they assigned me as the representative for you all. I had been here before, but for many years, I've been with Blue Cross, I don't want to say. But anything that you might need, please feel free to give me a call. Thank you.
Thank you, ma'am. Does that need to be an agenda item? It was just a presentation, so no, okay. All right, the next one, 2.2, review and discussion of the 2022-23 Employee Handbook.
So we do have Mr. Gonzalez here with us tonight to review some of the updates on our employee handbook for the 22-23 school year.
Good evening once again. Mr. Moreno, Mrs. Cervellon, and board members, I am here to provide to you a draft of the 2022-2023 Employee Handbook. What we do at the beginning, every summer is we take the TASB model that's provided to the district, and we align it with what we currently have in our employee handbook, and then we align and we look at the changes that are recommended by TASB, which are related to legislative updates and also any kind of board policy updates as well. So it's a balance between legislation, board policy, and then finally interjected into our employee handbook. So what you have in front of you is the initial draft that has the inclusions of all the updates that are necessary as per TASB. We do also include district information to our employees. For example, we have on page 8, those are the district operational hours for our staff that tells every staff member that fall under those assignments or those campuses exactly what the report times are going to be and anything that they need to do, any assignments that they need to have with their schedule. So that's provided there. We provide the map of the district so that anybody has any questions about where someone is zoned or how we service our students is provided in there. What we'll do, there are some cosmetic changes, what I call cosmetic changes that need to be changed, and that is due to the vacancies that we currently have. Hopefully, we'll be updating those tonight, so that way we can work on the final names, especially on the administration component, and also including not only their names, but also their titles as well. We'll also update, if you notice throughout the draft, there may be sections where you see a green item or a highlight, and that is what those are references that we make to certain topics in that statement. So that way we align it correctly with the page that employees can find that particular item. So there's some final edits that need to be done, and I'll be working with the new executive director of this division, so that way we can ensure that the draft that goes to your board meeting the next time is a clean, updated copy with everything aligned and updated.
You said that would be at the next board meeting?
I believe so. It would be
tomorrow?
Yes, sir. Tuesday.
Tuesday. We'll work diligently. I'll work with Ms. Erica, and I'd like to congratulate her as well. I'll be working with her so that way we make sure we make sure that the draft is ready to go. Okay.
Thank you, sir.
Are there any more questions?
Thank you, sir.
Thank you.
Thank you.
Okay. So this does not need to be an agenda item?
It does, I know that previously we have approved it here through the board, but it does not have to be approved by the board. It can be as an informational item. How do you all want to address it? Do you want to put it in as a board agenda item for approval?
He said there would be more changes to it, right? That
Correct.
it would be a final draft? Since there's still a final draft pending, then we'll go ahead and put it as an agenda item then.
Okay.
But to go back, if I may, Ms. Lopez, to answer Ms. Cervellon's question, most districts don't have the board approve the
Because of the
employee
changes.
handbook. Like Mr. Gonzalez alluded to, it is drafted from the model TASB employee handbook, and they make all the updates and even the cosmetic changes. That's a term that I use very frequently when we are working on these handbooks. And so basically, usually when it comes to even the student handbook and the employee handbook, aside from a legislative year when the board does approve the code of conduct, those other two handbooks are just informational for the board and not necessarily need to be board adopted or board approved. And then the other thing that's usually, the disclaimer that's usually noted on those two documents is that board policy will supersede anything that's in there. Because, there's room for error, very minimal, but board policy will supersede anything that's in either one of those handbooks. Am I correct, Ms. Cervellon?
Yes, sir. And if we do have it board approved, that means anytime we change something in the handbook, we have to continue to bring it
It
back
needs to
the
come
board.
up for board approval, correct?
No,
So I don't see I personally don't see the need for a board approval, just have it presented to us as an informational document. But that's just my opinion.
So this would just be an agenda item for a review so they can provide us an updated version, not approving anything. Thank you. The next agenda item, 2.3, review and discussion to add and revise policy update 119, local policies as recommended by TASB Policy Service.
Yes, so we did have TASB review our local policies. This is our update 119. As you can see, the policies, local policies are delineated and attached where the changes were suggested by TASB. So we're bringing it forth tonight for approval as that it will modify local policies CPC, DMA, EHAA, EHB, EHBAA, EHBB, EIF, FFBA, and FFH. And again, these are the suggestions through TASB. A lot of it has to do with verbiage and then the deletion of information that is not required or no longer appropriate.
Are there any questions or comments?
No, I went over the changes, and it does seem to be just a lot of difference in wording, nothing actually being completely changed.
Okay, so 2.3 becomes an agenda item. Moving on to 2.4, review and discussion to appoint a delegate and alternate for the 2022 Delegate Assembly.
So here is when we would make our decisions on who we want to appoint as our delegate and our alternate for the September 24th TASB, TASA Convention in Dallas, Texas.
I would like to appoint Janie Lopez to represent us at the conference.
I will gladly represent pending the board vote next meeting.
I think last year was Janie and Oscar as the alternate, so
And
I think,
alters alternate. Okay.
2.4 becomes an agenda item. And 2.5, review and discussion to revisions to the 2022-23 compensation plan.
Yes, at this point, I'm going to ask Mrs. Erica Echartea to approach the podium. There are certain adjustments that need to be made that were, left off, and then there's a couple of adjustments also to the compensation plan.
Yes, good
Erica?
evening, Board President Moreno, members of the board, Ms. Servillon. Changes to the compensation plan include, on page 4, the addition of 2 positions. One is a ADSI project manager that is going to be grant funded, and then a part-time dyslexia coordinator. On pages, they're highlighted in yellow for you as well, 6, 7, 9, and 10, those are positions that were just inadvertently left off the previous plan.
Clerk Wright, Secretary? Okay.
They were just inadvertently left off. Like, we currently have those positions, they were just left off of the previous plan that was approved.
On page 6, the secretary for after-school program, it says contingent on grant funding, though? That's currently how we have it as well?
Yes.
Okay, I just wasn't sure.
Any other questions or comments?
Well, on page 11, there was a dyslexia supervisor stipend that was added. And then on page 19, we removed the COVID recovery stipends from last school year. Any questions?
Okay, since there's no further questions or comments, that becomes an agenda item. 2.6 will be tabled until further notice. And 3.1, any committee concerns or questions?
I do. I'd like to bring up a concern if I may. Can you all hear me? Can you all hear me?
Yes, sir.
Okay, a recommendation, Ms. Rayon, I'd like for you to look into something on behalf of the board. I think right now it's kind of scary. We're going back and forth with this COVID dilemma, and hopefully we we won't go back to mandating masks and all that stuff. And we just hope. I personally hope that this just goes away. But my concern is the need for substitutes that seems to be affecting not only our district, but the other districts in Texas, as well as the state, across the state. And so one of the things that I would like for you to look into, the possibility of looking into our budget and seeing if we may be able to offer a stipend for perfect attendance to our teachers. I'm an administrator, and administrators know how hard it is to get a suitable replacement for our teachers. And we have teachers that do a phenomenal job in our district, and we want them to continue to do so. And, anytime teachers are not present for whatever reason, of course, there's sometimes circumstances beyond our control, but, it hurts our kids. And in doing so, I know that there's even some districts that are having to, deny people from taking the day off because there's just nobody to cover those classes. And so with that said, I think that we need to look into providing an incentive to those teachers that despite the hardships that they face on a daily basis, they make it a point to be on campus every single day. And so my thoughts would be a $500 stipend per semester. And once again, the question always comes up, well, what about perfect attendance for the other departments? And, when it comes to teaching, teachers are the ones that we struggle finding replacements for, and that we actually have to bring in somebody to take their place for instructional purposes. Other departments at this point, we don't get subs usually for other departments. So when it comes to teaching, I think it's something that we really need to look into. And if at all possible, Ms. Alvarez, please look into that, into the feasibility of being able to do that for our staff.
I know that we used to have a stipend like this in place in the district, and I understand where you're coming from, Mr. Moreno, just because of the fact that it is hard to staff a classroom and it's a lot of responsibility for one person. But my only concern with these stipends is, if the money's on the table, I'm gonna wanna come even if I'm sick and should be staying home. And I think that's something that we need to consider, especially with COVID. Like, I wouldn't wanna be here with COVID, not infecting the kids, but making other people vulnerable to it as well, when I should be staying home, but I'm gonna come to work because of the stipend that's on the table. And I don't know
I'm sorry, go ahead.
And I don't know why it was taken away or anything like that, but that's immediately my concern when it's a good idea and it's good in theory, it's just the implementation of it puts other people at risk if they're coming to school just so they can get the money, when they really should not be on campus. They should be at home resting, recovering, and getting better.
But now my comment to that, to Dr. Cruz, is that campus administrators are in most cases visible. The visibility is very important for campus administrators, campus nurses. And you know what? When push comes to shove, that concern is shared among peers. And you know, and speaking from experience, you know, you're correct. Maybe a person will want to come in that maybe is running the temperature or whatever, but you know, camaraderie and people collaborating, see these things, and you know what? People take great strides in making sure that everybody's healthy. And so I think that would be minimal. I'm not saying that it won't happen, that it's an impossibility, but by the same token, you know, there's also teachers, and way back in the day when I first became a teacher, you know, not knowing any better, you know, we would get 5 days of sick leave and 5 days what they called convenience leave or whatever. And, you know, I remember my first year, hey, that's 10 days off, you know, and 10 days off, not thinking, you know, back in as a rookie teacher, you know, those are 10 days that I'm going to be affecting my students by not being there. And so those are situations to where, you know what, we've got people now reflecting, you know what, my days are my days, but I need to be here. And if I'm going to get compensated or receive that type of stipend, you know, I'm going to do my best to not take a day off just because I want to take a day off. My kids need me, and that's what I signed up for.
I know that we did have that, the stipend in the past, and it was a $500 stipend in the fall and a $500 stipend in the spring. When they did the numbers for us, I was a principal back then, they showed us the cost of substitutes, you know, and that's just the financial cost. That's not the educational cost, right? Because the educational cost of a substitute versus a teacher is a great impact. So, it actually not only paid for itself, you know, there were additional savings. So those stipends did, you know, it did help the teachers, you know, to come more regularly to get that stipend in the fall and the spring. And if you missed it in the fall because you were sick, you still had an opportunity to get it in the spring. So we did see a cost savings ultimately when it came to substitutes. I really don't think, in thinking about our staff, that somebody would come in and intentionally have COVID and, you know, and I guess continue to spread the disease knowingly. I also know that we have systems in place where we're looking at the symptoms. And, you know, if it comes to a point where this person is symptomatic, you know, the principal has, you know, tells them, okay, you know what, we need to test you because can you show me a negative test because you are symptomatic if it comes to that point. So I think that there would be that as well. But I can look into the feasibility of it to start the conversations, and then you all can make decisions from there. And if you have more reservations or other information that you have, you know, that's when we can talk about it deeper, at a deeper level.
Yeah, I don't, personally for me, it's not the financial impact that worries me, it's just the, like,
Yeah.
I mean, teachers are, not just teachers, but just anybody on campus gets burned out. And are you doing more of a service to your students being there, being burned out, or are you doing more of a service taking a day that you need to recuperate and then coming back and giving your 100% to your students and to your colleagues? And
Well, I also see it that if somebody really needs a day off, I think that they will take that day off. I mean, again, it's $500. It is a small carrot. It's not a huge carrot. And so, you know, if you start breaking it down by daily rate, et cetera, I mean, it's just a perk if you have that perfect attendance. So,
I think that we have to trust our employees also to know that they know best and that they're not going to maliciously come to work knowing that they have COVID. And now with so many tests available, and even with our insurance for free, that people can get tested to see if they do have COVID or not, right? And they would use good judgment. I trust the employees to use good judgment to know also, you know, hey, well, I was exposed to someone with COVID. You know what? I have symptoms. I'm going to stay home just to be on the safe side, right? So I think that we have to trust our employees as well. All right, so no further comments or questions, so let's go ahead and adjourn this meeting, and the time is 6:35 PM. Thank you.